Your feet are a diagnostic window into your health problems. In other words, this right here will tell you a lot about early signs of many different problems. At the end of this video, you're going to have the ability to understand a lot about what's going on inside your body just by looking at your foot or someone else's foot. Right here, we have the heart and we have the foot. And this little connection between the heart and the foot is your blood vessels. You have the most oxygen starting at the heart, and you have the least oxygen starting in your foot. The foot is going to receive oxygen and nutrition through tiny little capillaries. If someone has sugar in their blood, as in diabetes, it's going to show up in your foot first as the earliest sign. I'm going to go through a series of indicators that will tell you what's going on in the rest of the body. First topic I'm going to cover is something called peripheral neuropathy. You might start with numbness or even like burning, and then it can go into some weird sensations. It just feels abnormal. That's because the sensory nerves are breaking down because of mainly one missing vitamin called vitamin B1, thiamine. There's not enough thiamine in that nerve to allow the nerve to work. That nerve is dependent on B1. You need a very special type of B vitamin that has been changed to a fat-soluble version. And the name of that is called benfotiamine. I'll put in the description of how to spell it. There's not enough thiamine in that nerve to allow the nerve to work. And there's a couple things that will deplete B1 from the nerve. Sugar destroys nerves. If you drink a lot of alcohol, it destroys your liver. Sugar and alcohol deplete B1, and you want to put that back. Benfotiamine is what you need. Whatever it recommends in the dosage on the back of the bottle, times 4. Because you want to take more to really penetrate to fix this problem right here. Another diagnostic indicator or a window to look inside your body is to notice if your toes get blue. It could be the fingertips too. It has to do with a part of the nervous system called the sympathetic nervous system. Another word for that is called the fight or flight system. And there's a problem with this system in that it's overactivated. One of the treatments for this, the medical treatment, is they use a calcium channel blocker. When they're exposed to cold, their fingers and their toes become blue. What would be a natural version of a calcium channel blocker? That's magnesium. Magnesium is the primary regulator of calcium that's stuck inside the cell. And so one cause of high blood pressure is too much calcium, because calcium is all about contraction and magnesium is all about relaxation. So magnesium fixes this overcontraction problem. The thing to know about magnesium is that you don't want to just take any type of magnesium. You want to take magnesium glycinate because that's the one that you can absorb like 80%. The next one also relates to what I just talked about, foot cramps, especially at night or in the early morning. Magnesium in the tissue is going to be lowest in the early morning. You can also get those cramps in the calf muscle right above here. Cramps or Charlie horses are the earliest symptom of a magnesium deficiency. The simple remedy is to take magnesium glycinate. Remember we talked about that. You want to take at least 4 to 5 to 6 to even up to 800 milligrams for a period of weeks to really fix this deficiency. Just by taking it one time doesn't really help it. The problem with magnesium deficiency is that it's very hard to detect, and a lot of people are deficient in it. Magnesium is really important in a lot of things. If you're deficient, you're going to have cramps. Putting the magnesium back in there will help the cramp. The next thing I want to talk about is when you have swollen feet. This usually is involved with diabetes because they have more sugar in the blood. And if someone has more sugar, they're going to be retaining a lot more sodium and a lot more water, and they're going to have puffy feet. The antidote is to come up with sugar if you have diabetes. Another problem that you might have, discoloration of the lower leg, just the feet start changing colors and they look very unhealthy. It could be a circulation problem. You can have deep vein thrombosis, which is a condition where you're getting clots in the veins, and that's going to create fluid retention in the foot, discoloration in the lower part of the leg. And so those clots can come from many different reasons, one being high levels of stress. And also vitamin E is an antidote to excess clotting because vitamin E kind of thins the blood. If you get more pain or more weakness when you exercise, suspect something called intermittent claudication and get it checked out from the doctor, because that's a vascular problem. And with that problem, you get better when you rest. Next problem is big toe pain right here. That's gout. Gout usually is a problem with too much uric acid. Some people even notice if they cut down their oxalates, their toe pain goes away. And that would be like spinach, almonds, chocolate. The antidote to high levels of oxalates, whether it's a kidney stone or whatever, is magnesium, and prevent the kidney stone situation or the oxalate arthritic situation that some people have. Other ways that you can diagnose things on your foot: if you have an ulcer on the foot, that's classic diabetes because you're not getting enough oxygen. In a diabetic situation, if you notice, the toes of the feet get destroyed first, and then it moves up this way. This is why they have to sometimes remove the toes in diabetics. Completely unnecessary. You need that benfotiamine, and you need to get on a low-carb diet, but unfortunately you probably won't hear that from your doctor. They're more into managing your symptoms. Couple things with the nail bed. You can look at the nail bed of your toes and tell a lot about your overall health. Like, for example, if it's like yellowish, that could be fungus, but it could be jaundice too with the liver. But if there's a fungus, that means there's a problem with your gut. And you can fix fungus by adding probiotics and really getting healthy, starting with your gut. Now, there's all sorts of remedies as well, like tea tree oil and iodine on the toenail. If your immune system is weak because you don't have enough vitamin D, then the yeast wins. And of course, yeast lives on sugar, so you're going to have to get off sugar as well. If there's funkiness with the toenail, like splitting, let's say it's curving up or curving down, these are all indicators of not necessarily disease, but nutritional deficiencies. But in this video, I just wanted to give you some insights on how to use your foot as a diagnostic window to other issues. And if you want to know more information about the nail beds, you should watch this video right here. Check it out.